the pre-workshop and post-workshop activities also. It's good that he is here with us, and he will be talking to you on various categories of waste as per BMW Management Rules 2016. And uh, last time also he took quite a good number of sessions, and students were immensely benefited. We had shared the recordings of the presentations made by Dr. Chandrababu last time, and it's a unique opportunity for all of us to listen to Dr. Chandrababu on this important topic. And let us welcome him. Sir, you are welcome to IGNOU Regional Center Bhubaneswar, and we are very much grateful to you. So I request you to kindly make your presentation.
Sir, am I talking to Suresh Kumar Tripathi, na? Yes, sir. Okay, sir. Good afternoon, sir. Thank you for giving the introduction about me. I feel I consider myself as a learner in the field of any field. I consider myself as a learner. Therefore, there no end to learn knowledge. And whatever the knowledge I gained over a period of the 2009 to 17, which I dealt this subject, especially when I was in CPC Delhi office, I dealt this environmental waste management activities in the country. I was a expert member of IGNOU to come out with this the course syllabus as well as the materials for 6 months certificate course. I'm also one of the author, expert, editor. I played all roles. And anyhow, thank you very much for giving me this opportunity. There are so many experts in the country. Still, they have chosen me, means I should give the my thanks to IGNOU for choosing me for giving counseling for these students. I request some of the students kindly keep your microphone in mute, please. Jayasri Vadir, kindly keep all of you kindly keep your microphone in mute, unless it is asked. Unless when I ask you, you may raise your questions. At the time, you can start your microphone in mute. Please kindly keep your microphone in mute, please. Can you see my yeah, Jayasri Vadir? Please kindly keep your microphone in mute. Jayasri Vadir, please kindly keep your microphone in mute, please. Yeah, can you see my slide, please? All of you?
Yes,
No,
sir.
it is not visible.
Okay. Yeah, you all know healthcare waste is very important waste in the waste management scenario. You should know what are the various types of waste and what are the various impacts if the healthcare waste is not properly disposed of. What are the probable impacts because of the various waste, and how to segregate the waste. Of course, today I was told to take up a class on categories of healthcare waste, categories of biomedical waste as per government of year notification. It is a very small subject. Covering 2 hours is very vast, too much. It is not required that much time. Still, in order to cover up 2 hours of my lecture, I am going to give you different scenarios, different aspects, how to do it and what are the impacts and all. And ultimately, you will come to know how to segregate what goes at healthcare facility level so that the further treatment and disposal can be done by the treatment facility operator. Before you go into that, you have to understand what is waste, what are the types and classification of waste, what is biomedical waste. In between, I may be asking you questions. Please kindly be alert. Okay, you have to keep on note down, and I'll be asking you questions. Then you have to give reply to my questions also. And we're also going to learn today what are the sources of healthcare waste, categories of healthcare waste as per WHO, World Health Organization, and what are the categories of biomedical waste as per Government of India Gazette notification issued in 2016 under the Environmental Protection Act 1986. What are the harmful effects of healthcare waste if not managed properly on human health and environment? Let us see what is the waste. Waste is any item or thing for which the immediate owner can find no particular use. Then definitely we call it as a waste. When any waste is not having any value, then we call it as a waste. Waste is also referred to as a resource in the wrong place. In a sense, the definition of waste is a subjective. What is waste to one person may not be waste to another. Therefore, it depends upon the person to person whether the waste is a waste for him or not, or useful raw material or resource material. For example, paper daily newspaper generated in the household is not a waste for a housewife, because it is going to give some revenue for her on monthly basis or quarterly basis. Because when you sell the old paper, we get some revenue. Therefore, the daily newspaper is not a waste for a housewife, because it has got the some value addition. Therefore, it is not a waste. Therefore, for some people, any paper is there, they may throw it onto the road or streets or whatever the way they feel. Then that is a waste which he feels that no value is there. This is the difference. Therefore, let us have a look at the definition of waste as per Basel Convention. Basel Convention, it is the convention agreed or signed by the Government of India. It is in connection with the control of transboundary movement of waste from one country to other waste. Of course, waste is allowed for recycling, but not for disposal. Therefore, any waste is coming as a gift. For example, some type of e-waste, the foreigners will be sending as a gift for reuse purpose, that is allowed. Any waste which is there for disposal is not allowed in this country from any other country. That is the convention for which the Government of India is a treaty, and we have signed this convention, and we are bound to follow the convention principles definitely. And what are the definition of waste as per WHO, World Health Organization, how they have defined the waste, and the Environmental Protection Act 1980. Let us see the definition of waste first. Yeah, any questions, please? If somebody wants to have any question, you can ask me, please. Yeah, if you talk, just suddenly I will stop. No questions, then we'll proceed. The simplest dictionary meaning of waste is material that is not wanted or what is no longer of any use. Therefore, we call it as a waste. Basel Convention on Transboundary Movement of Hazardous Waste, as per 1989 Convention, it says waste or substances or subjects which are disposed of or intended to be disposed of or required to be disposed of by the provisions of national law under the Waste Framework Directives. The European Union defines waste as an object that holder discards, intends to discard, or is required to discard. Whereas the World Health Organization defines healthcare waste as all the waste generated within healthcare facilities, research centers, and laboratories related to medical procedures is called as the healthcare waste as per World Health Organization. In addition, it includes some type of waste originating from minor and scattered sources, including waste produced in the course of healthcare undertaken in the home. For example, home dialysis, self-administration of insulin, recuperative care, etc., is also called as the healthcare waste. As per the Environmental Protection Act 19, I think actually no, there is amendment. It is 1993, but actually Environmental Protection Act is 1986. Waste means any discarded, rejected, abandoned, unwanted, or surplus matter, whether or not intended for sale or for recycling, reprocessing, recovery, or purification by a separate operation from that which produced the matter, or anything declared by regulation or by an environmental protection policy to be waste, whether of value or not. And different the organizations have defined waste as in a different way in accordance with the requirements. And let us see what is various classification of waste as per source of generation. According to source of generation, waste are classified as municipal solid waste. Municipal solid waste, which is generated from residential and commercial activities, it is a solid waste, municipal solid waste. And any waste generated from industrial activities or industrial processes, it is called as industrial waste. In other words, it also can called as industrial hazardous waste. Depending upon the toxic nature of the waste, you can call it as industrial hazardous waste, or some waste of generated from industries may not be toxic in nature, but industrial non-toxic hazardous waste can be classified further. Any waste generated from agricultural activities, like residues from agricultural activities, can be called as agricultural waste. Similarly, waste from human or animal health care and related research is called as healthcare waste. These are the type of waste as per source of generation, and what are the classification of waste as per physical properties. Especially if you come to the according to physical properties, waste can be called as the solid waste or liquid waste. Solid waste is further classified into biodegradable waste or non-biodegradable waste. Now, what do you mean by biodegradable waste? According to Municipal Solid Waste Management Rules 2016, biodegradable waste means any organ material that can be degraded by microorganisms into simpler stable compounds. It consists of mainly organic waste such as peeling of potatoes, bananas, sawdust, and water hydrants dumped within the municipal environment, and this constitutes bulk of the generated waste. Therefore, all any waste which is biodegradable in nature can be called as biodegradable waste. Non-biodegradable waste. Non-biodegradable waste means any waste that cannot be degraded by microorganisms into simpler, stable compounds. Then, such a waste is called as non-biodegradable waste. Examples are polythene bags, plastic products, toys made of plastics, process waste, highly flammable and volatile substance, furniture, abandoned vehicles, used tires, industrial waste including metal scrap, etc. They are all non-biodegradable waste. Now, the other form of waste, depending upon the physical properties, is the liquid waste. Liquid waste is classified into three categories, subcategories. One is black water, and gray water, and storm water. Now, by means of the by name itself, it is self-explanatory. Like black water, any waste containing the liquid waste containing human the urinals, urine, as well as the human the waste can be called as black water. Any liquid waste containing generated from other than these the laboratories or can be called as gray water. Maybe like kitchens and other things, laboratories, etc. can be called as gray water. And storm water, any water which is flowing through these stormwater drains can be called as stormwater. Therefore, these are the types of waste classification depending upon the physical properties. One is solid and liquid. Solid is further classified into biodegradable waste, non-biodegradable waste, and liquid is classified into three categories, subcategories. One is black water, gray water, and storm water. This is what the liquid waste. Black water is wastewater from toilets containing fecal matter, or the gray water is or sewage. In other words, grey water is also called as sewage, is wastewater from bathrooms or kitchens. Stormwater, which represents the rainfall collected on hospital roofs or garbages or natural drains, can be called as stormwater. Grey water generally contains fewer pathogens than black water. Black water generally contains huge the innumerable number of microorganisms, whereas grey water may contain fewer pathogens. And the classification of waste according to hazardous nature. Waste can be classified into other like one more nature called hazardous nature can be called as e-waste, radioactive waste, infestation shops, hazardous chemicals, and pharmaceutical waste. They all fall under the category of hazardous in nature. Therefore, they are called as hazardous waste. In other words, also infectious waste or biomedical waste. We call it as infectious waste or biomedical waste. In India, we generally call it as biomedical waste, which includes shops, soil waste means waste cotton soaked with blood. Okay, any soiled, any cotton soaked with body fluids or blood can be called as soil waste. Body fluids, human anatomical waste, cultures, discarded medicines, chemical waste, used needles and syringes, glass slides, fetuses, placenta, infected dressing materials, etc. can be called as infectious waste, which are generally generated from the healthcare sector. Now, any waste which is generated from healthcare sector, which is infectious in nature, can be called as healthcare waste. Even from the healthcare facilities, the waste generated may not be highly infectious or may not be infectious. Then, in such a case, that waste is not healthcare waste, not biomedical waste. It is non-infectious waste. Therefore, from healthcare facilities, there are two types of waste generated. One is infectious waste, and the other one is non-infectious waste. And this healthcare waste, I told you, it will have both infectious and non-infectious waste. General waste generated from hospitals is about 85%. Just have a look at these figures. 80%, 85% of waste generated from healthcare waste is non-infectious, means general waste. It is not at all not categorized under not categorized under healthcare waste. It is non-infectious healthcare waste. Whereas infectious waste is only about 10% in nature and which is highly infectious in nature. Therefore, 10% of waste generated from healthcare waste is only the healthcare waste is called as biomedical waste. Generally, it is a biomedical waste. And other waste are also generated. They are hazardous in nature. They are like chemical waste and radioactive waste. Therefore, we have to take care of the healthcare waste only in case of 15%. Only in case of 15%. That is this kind of, that is one is the infectious waste, and other one is the chemical radioactive waste. And other one is general non-infection, the infectious waste. That means if waste is taken care of, 15% of waste is generated from healthcare waste is taken care of, the waste can be managed properly. Now, if this 15% of the waste generated from hospital is mixed up with general waste, then only the problem arises. That means they are converting all general waste into infectious healthcare waste. Means if you are not properly taking care of the 15% generated infectious waste, not properly managed in an environmentally sound manner, if you are mixed up with general waste, you are converting all general waste also as infectious waste. Thereby, what will happen is you are converting your generation of waste will be more, the cost of treatment of waste will be more, and naturally, in the process of treatment of waste, such a huge quantum of waste, then it is going to cause impact on human health and the environment because you are handling more and more waste. Therefore, from the healthcare facilities, infectious waste has to be properly segregated, collected, treated, and disposed of. Therefore, the generated waste is properly managed, and you are not going to convert general waste into healthcare facilities, healthcare waste. Therefore, segregation is a must. Proper collection, treatment, and disposal. This 50% of healthcare waste is a must, so that you are not going to convert general waste into healthcare waste. Therefore, healthcare facilities should play a major role in collection of this healthcare waste, infectious healthcare waste, properly segregated, collected, stored, treated, and disposed of, so that the cost of disposal of this healthcare waste will be minimum. Naturally, the impact on the environment also will be very less compared to treatment of huge quantum of waste. Terminologies. Generally, we are telling as hospital waste, we are also calling it as healthcare waste, we are also calling it as biomedical waste. All terminologies are one and the same. There is no any difference between this hospital waste, healthcare waste, or biomedical waste. Now, what is biomedical waste? 1 minute, please. 1 minute, please. Till now, any questions, please? Otherwise, we'll proceed for the other one, please. Now, you should remember, then what is the definition of biomedical waste as per government notification issued in the year 2016, that is called as Biomedical Waste Management Rule 2016, notified by the Government of India for the purpose of ensuring proper collection, proper segregation, collection, treatment, storage, and disposal of this healthcare waste. It says, the definition, it says, yeah, before I want to go, anybody is having about the definition of anybody is from healthcare field, healthcare departments or healthcare sector? Anybody is there from healthcare sector?
Sir, I am a student.
You're a student of medical student, madam? Anybody is there
Sir,
from
I am pursuing healthcare management.
wow, wow. Anybody else, please? Anybody is having a background on the medical field, or anybody doing
Yes,
some
sir.
medical course or nursing courses? Somebody, please? Yeah,
Yes, sir.
yeah. Tejaswani. Tejaswini. Somebody else? Anybody else? Okay. Okay, then Tejaswini, can you please tell
Yes,
me
sir.
what is the definition of biomedical waste then? Are you aware or not? I
Sir,
just want to know.
yes, sir. The waste which are produced in hospitals are biomedical waste.
Wow. Waste produced from hospitals can be called as biomedical waste. Just now we have seen one slide wherein I told the biomedical waste, the waste generated from hospital will have the composition is how much? General waste is about 85%, whereas the infectious waste is about 10%, and other waste is like hazardous chemicals is about 5%. Now, how can you call the general waste as biomedical waste? You cannot call any you cannot call any waste as biomedical waste. There is a definition. Anybody can try, please. Any other? Suppose even if you are wrong, don't worry. Even if you are wrong, don't worry. Somebody, if you are from medical field, kindly try what is the definition of biomedical waste. Kindly somebody can express what is the definition of biomedical waste. Whatever the way you know, please. Yeah, please. Dishaji, can you please define if you know?
Sir, I think if the general waste can be in future used or be caused as potentially infectious material, so it can
Yeah.
come under the category of biomedical waste.
Yeah, please. Though you are not in the class, please kindly interact with me through video as and when I request you or when I pose a questions to you, because you have to interact with me. Otherwise, you don't feel like live. Okay, it is a live class. Therefore, you have to interact with me. If you are having any problem, also we can clarify there. Now, Amir Balalji, I think so. You have sent some message. Can you please tell me what is the definition of biomedical waste, please? The way you understood, Amir Balalji, Amirji, Amir Bilal. Can you hear me?
Yes, sir. Yes,
Yeah, Amira Bilal. Can you please define?
yes.
Can you switch on your video, please? Can you switch on your video, please? Yeah, Amira Bilalji, can you please define what is the biomedical waste? The way you understood?
Yes, sir. Biomedical waste is any waste producing during diagnosis, treatment, or immunization in hospital sectors.
Okay. That's all? Okay, no problem. See, I just want to know what is your level of knowledge on the biomedical waste. That's why I'm asking you. Don't feel otherwise. Yeah, if you don't know, then no, I am just trying to find out what is the level of your knowledge on the biomedical waste. Now, it is easy for me to explain. Now, biomedical waste means, as per the Biomedical Waste Management Rules 2016, notified by Government of India under the Environment Protection Act 1986, biomedical waste is defined as any waste which is generated during the diagnosis. Any waste generated during the diagnosis is called as biomedical waste. Therefore, during the diagnosis, what type of waste is generated? Anybody can guess, please? During the diagnosis means what they do? They take samples and they do go for testing. Therefore, when they take sample also, what are they use? The needles and syringes, they all fall under the biomedical waste category. Any interstitial liquid, bloods or any urine that they take is also biomedical waste. Any waste generated during the dialysis can be called as biomedical waste. Okay, just remember one word. Any waste generated during the dialysis is called as biomedical waste. And second one, any waste generated during the immunization of human beings or animals. Immunization means टीकास वगैरह देते हैं ना, उसको बोलते हैं immunization of human beings or animals. Therefore, what type of waste is generated during the immunization? Anybody can guess, please? When you are doing immunization means any टीका वगैरह डाल रहा है तो आपको what type of waste is generated? Needles,
Syringe injections, needles.
syringe, then the दवाइयाँ, जो residual दवा या bottle होता है वो bottles, और कुछ वेस्ट कॉटन. जब नीरज सिरिंज डालने के बाद, नीडल डालने के बाद है ना, जो इंजेक्शन डालने के बाद जो उसको प्रोटेक्ट करने के लिए ये कहना क्या करते हैं, पहला एक कॉटन लेते हैं वो रखते हैं. दैट इज आल्सो blood will come in contact with the cotton. Therefore, that cotton is also biomedical waste. Secondly, the cotton, then they put sometimes, after taking blood and all from the vein, they put one tape. Therefore, after certain, they say you remove the tape. Therefore, when you remove the tape, that is also the tape containing infectious blood is also called as biomedical waste. Therefore, any waste generated in the process of immunization of human beings called as biomedical waste. Therefore, first one is any waste generated from the rare disease called as biomedical waste, and second one is any waste generated from the immunization of human beings or animals can be called as biomedical waste. Third one, in order to develop the medicines for the treatment of a patient or so, then that in the process of development of the medicines, they go for testing of the developing medicines on the animals, generally rats, or generally they use rats and all. They apply this developed medicine on the rats. They will try to find out whether this medicine is going to work or not. Therefore, what type of the animals that they live or dead, they become the waste can be called as biomedical waste. Therefore, any waste generated during the research activities pertaining to medical field can be called as biomedical waste. Therefore, D, we have learned about waste generated from the rare disease is called biomedical waste, D. And second word is I, immunization of human beings or animals can be any waste generated during the immunization of human beings or animals can be called as biomedical waste. We have learned about this. And third, any waste generated from the research activities can be called as biomedical waste. Now, what are the other words? Other one is treatment or immunization of human beings. Therefore, any person is being treated during the ailment, any waste generated during the treatment of or immunization of human beings can be called as, that is also called as the biomedical waste. Simple example I am telling, a person met with an accident, then they went to the hospital, then the doctor has decided to amputate his leg, or any hand is there damaged, or any problem is there. In such a case, if they feel that it is going to cause it is going to take his life, then in such a case, they amputate leg or hands wherever it is infected. Sometimes some operation has to be done for the humans because of some problem, ailments. And any waste generated during the surgery process can be called as biomedical waste. Amputated leg or parts in the process of treatment of human beings or animals can be called as biomedical waste. Therefore, fourth word we learned is T. First one is D, diagnosis. Any waste generated from the diagnosis called as biomedical waste. I, immunization of human beings or animals can be called as the biomedical waste. Any waste generated during the research activities can be called as biomedical waste. Any waste generated from because of the treatment of human beings or animals can be called as biomedical waste. And fourth one, sometimes we may not define all the types, we may not cover up all the waste from these four activities. Therefore, it has been linked with Schedule 1. Whatever the waste is referred to Schedule 1 of the rules can be called as biomedical waste. Therefore, if anybody asks you what is the definition of biomedical waste means, you should be able to say, as per Biomedical Waste Management Rule 2016, biomedical waste means any waste generated from the diagnosis or immunization of human beings or animals or research activities pertaining to medical treatment, medical developments, the treatment of human beings or animals, and the waste referred under Schedule 1 of the rules can be called as biomedical waste. That is how we have to define. Understood, please? Any doubt? Any doubt?
No, sir.
So what was the last one?
Last one I will tell you. Last one is schedule. Schedule means there is one table has been given in the rules, what type of waste, what color coding has to be managed or for the purpose of segregation. That I will show you. Just remember this word only. Biomedical waste means any waste generated from the diagnosis or immunization of human beings or animals, or waste generated from the research activities, or waste generated in the process of treatment of human beings or animals, and waste referred under Schedule 1 of the biomedical waste rules is called as biomedical waste. That is what you have to understand. Okay. If you have understood, then we'll go to the next slide, please. Is it okay? Clear? I'll show you Schedule 1 later on so that you'll understand what is that Schedule 1. Yeah. What are the major source of healthcare waste are? One is hospitals. It may be university hospitals, general hospitals, or district hospitals. Other healthcare facilities like emergency services, maternity hospitals, dispensaries, dialysis, military hospitals, the patient medical services, polyclinic. These are all called as these are the source of healthcare waste. Related laboratories, medical laboratories, research centers, including forensic labs. They're all the healthcare waste generating sources. Mortuary and autopsy center also, they're also the healthcare waste generating sources. Animal research and testing, they're also healthcare waste generating sources. Blood banks and blood collection centers, they're also healthcare waste generating sources. Nursing homes, especially the nursing homes are there, including for treatment of elderly people, they're also are the source of healthcare waste. Minor source of healthcare waste are there, which includes small healthcare centers, maybe a first aid. For example, first aid may be there in schools and colleges. Therefore, they are also source of the healthcare waste generators. Physicians, small amount of the biomedical waste may be generated by the physicians also. They may give only injection. Therefore, they may generate small quantum of biomedical waste. Dental centers, they're also may be generating small quantum of biomedical waste. Acupunctures, they're also may be generating small quantum of biomedical waste. Specialized healthcare establishments like psychiatric and disabled centers, they're also the minor source of healthcare waste generation. Non-healthcare facilities such as cosmetic, ear piercing, tattoo parlors, they're also covered under they are the small generators of healthcare waste. Funeral, ambulance services, and home cleaning, they're all the sources of healthcare waste. These are all the major sources and minor sources of healthcare waste. These are the centers from where you can expect that the biomedical waste can be generated. What are the categories of medical waste as per WHO? World Health Organization has categorized healthcare waste into 6 categories. One is hazardous category. First one is hazardous category. What are the hazardous category? Under hazardous category, there are shops are there. Infectious waste, any biomedical waste that is infectious or contaminated is called as one of the category as per WHO. And pathological waste, body parts of humans or animals, including tissues, fluids or blood fluid, contaminated with pathological. The pathology means viruses or the microbial contamination. They are all pathological waste. Pharmaceutical waste and cytotoxic waste. Any waste generated from the pharmaceutical unused drugs, medicines or creams that are expiring, including cytotoxic drugs. Cytotoxic drugs are nothing but these are the drugs used for the purpose of treatment of the cancer patients. Any residual drug is there that is called as cytotoxic drug. Chemical waste. This is also one type of chemical waste as per WHO as hazardous category. That is liquid waste from medical equipment, batteries and disinfectant chemicals and waste containing chemicals. They're all chemical waste as per WHO. Radioactive waste. What do you mean by radioactive waste? Any waste containing potentially radioactive materials, they're all called as radioactive. Therefore, as per WHO, the waste generated from healthcare facilities is categorized into 2 categories. One is hazardous category and non-hazardous category. Under hazardous category, there are 6 categories. One is shops, infectious waste, pathological waste, pharmaceutical waste and cytotoxic waste, chemical waste, and radioactive waste. Whereas in case of non-hazardous waste, all waste other than the above, like general other waste, all other waste that does not pose any particular biological, chemical, radioactive, or physical hazard, then they're all called as non-hazardous waste. Means general waste, like municipal solid waste, they're called as non-hazardous waste. All other categories as per WHO is called as hazardous category, 6 categories, whereas all other waste will fall under the purview of non-hazardous category as per WHO. Now, what are the source of hospital waste in healthcare facilities? Within the hospitals, what are the source of waste? Hospital waste generation sources are medical wards. All the wards, these generate hospital waste. Operating theater, they generate infectious waste. Laboratory, which includes microbiology lab, biotechnology laboratory, they all generate the infectious waste or biomedical waste. Pharmacy store, any residual waste is there, pharmaceutical waste that we called as outdated drugs. They are pharmaceutical drugs. They are all outdated drugs also fall into the category of the healthcare waste from healthcare sector. Healthcare, the pharmaceutical center can be called as, that is also called as the healthcare waste. Radiology departments, any waste generated from radiology department can be called as the biomedical waste. Chemotherapy waste, these are also called as the chemotherapy waste means any radiative treatment is given to the cancer patients, they are all called as the healthcare waste. Vaccination campaigns, environmental sanitary services, engineering services, food services, they're all the major source of hospital waste. And minor source of hospital waste are physician offices, dental health centers, and home healthcare centers. They're all minor source of hospital waste. What are the categories of biomedical waste as per Schedule 1? This is what the Schedule 1 as per other waste, the biomedical waste management rules 2016 notified by the government of India. One is, I'm sorry, 1 minute please. The official call is there. Yeah, sorry, there is some official telephone. I attend it. This is, there are, as per biomedical waste management and handling rules, there are 4 categories of waste. One is yellow category, second one is red category, third one is white category, and fourth one is blue category. These are only 4 types of waste as per Schedule 1 of the rules. What is that 4 types of waste? There are subcategories like this. What is that? Human analytical waste. Any waste generated because of the surgery, etc., human tissues can be called as the human analytical waste. Similarly, animal analytical waste, soil waste, any cotton soaked with body fluids or blood or any the infectious liquids can be called as soil waste. Expired or discarded medicine, they're all called as yellow category waste under the biomedical waste management rules Schedule 1. Chemical waste, chemical liquid waste is also one type of biomedical waste category under Schedule 1 of the rules. Discarded linens, mattresses, beddings contaminated with blood or body fluid. You always have to understood one thing. They say not contaminated linen, mattresses, beddings cannot be categorized as biomedical waste. It clearly says discarded linen, mattresses, beddings contaminated with the blood or body fluid, routine mask and gown, all called as the biomedical waste, yellow category. Microbiology, biotechnology under the clinical laboratory waste, also called as the yellow category waste as per biomedical waste rule 2016. Therefore, all these categories fall under yellow category, and all these waste has to be kept only in segregated only in yellow colored non-chlorinated plastic bags or containers only. This you have to understand. Now, all these waste has to be segregated into yellow category, and this waste has to be kept only in yellow colored non-chlorinated plastic bags or containers only. And this type of waste generally will go for incineration, is further treated and disposed of by incineration or by plasma pyrolysis or deep burial or as such under the rules. Therefore, these are the technologies suggested under the biomedical waste rules for treatment of this type of waste, that is, which fall under yellow category, and this yellow category waste has to be segregated only into yellow colored non-colored plastic bags or container only, and all these waste, segregated waste, have to be treated and disposed of by using technology called as incineration or by plasma pyrolysis or deep burial. This about the technology is concerned, the respective you will hear the class in non-burn and non-burn technologies for treatment of, therefore where you'll come to know about the full details. Now, second category of waste as per Schedule 1 of the biomedical waste rules is, one is red category. Here, red category is nothing but contaminated waste plastics or recyclables. All plastics which are contaminated in nature or infectious in nature, that plastics will fall under the category of red category, which includes waste generated from disposable items such as tubes, which are infectious tubes, bottles, plastic bottles, intravenous tubes, which you use for intravenous tubes, which are used for the purpose of saline, and sets catheters, urine bags, syringes. All these waste plastics or these categories have fall under the category of red category. These red category waste have to be segregated into red colored non-chlorinated plastic bags or containers only. And these particular waste can be treated by autoclave or microwave or hydroclaving followed by shedding is a must. Therefore, these are the technologies stipulated under the rules for the purpose of treatment of for the purpose of treatment of biological waste. For the purpose of treatment of waste, these are the technologies has to be used for the purpose of red category of plastics, which all the plastics have to be segregated into red color coded container bag, non-chlorinated plastic bag or container has to be used. These segregated waste can be further treated using by autoclave or microwave or hydroclaving, followed by shedding. Why shedding is must? Anybody can guess, please? The rule says if the waste is segregated into plastics, all infected plastics are segregated into red color the container plastic bag. These are required to be treated by autoclave or microwave or hydroclave, followed by shedding. Why shedding is must? Anybody can guess, please? Yeah, somebody can try, please. Somebody can respond. Yeah, Tejaswini, can you please respond? Why? After treatment of plastic waste, you have to go for treatment. The shredding is a must. Anybody can guess, please? Why? The plastic waste has to be shredded. Shredding means you have to cut into pieces, small pieces. Anybody can guess, please?
For recycling.
To avoid, to avoid reuse. See, suppose if any the plastic bottle is there or any plastic tubes are there used for the purpose of selling purposes, if it is not shredded, there is a possibility for reuse of them. In order to avoid reuse of these plastics generated from healthcare facilities, the plastic waste after treatment, not before the treatment, after treatment, this has to be segregated, the shredded means cut into pieces in order to avoid reuse. In order to avoid reuse, the plastic waste after treatment by autoclave or microwave or hydroclave, these waste treated plastic waste has to be treated, the shredded into pieces in order to avoid reuse of plastics generated especially from the hospitals. Therefore, in order to avoid reuse, these treated plastic has to be shredded. Okay. And after shedding, these treated plastics can be sent for recycling purpose for the purpose of after treatment. This has to be shredded. After ensuring the waste is properly treated, then this waste can be sold for recyclers for the purpose of recycling. Okay. Without treatment, these plastics are not allowed to dispose of through recyclers. It has to be ensured proper treatment. Then only it has to be sold for recycling items. And other activities, of course, apart from recycling activities, it can also be used for the purpose of the recovery of for energy recovery. It also can be used for the purpose of recovery of diesel or fuel oil, or for road making, whichever is possible. Plastic waste should not be sent to landfill sites. Therefore, because they are not biodegradable in nature, maybe it takes lengthy years, hundreds of years to go for biodegradable in for biodegrading these plastics. Therefore, the plastics have to go for recycling activity or for energy recovery or for recovery of diesel or fuel oil or for road making. These plastics can be sent for further recycling reuse. Now, the third category as per rules is the white. What is this white category is called? All
For
waste shops,
needles.
including metals, all metals waste shops, which includes needles, syringes, and fixed needles, needles from the tip cutter or burners, scalpels, blades, the already other contaminated sharp object that may cause puncture and cuts. This includes both used, discarded, and contaminated metal shops. Therefore, all these categories will fall into the purview of the biomedical waste. Therefore, how to Therefore, all waste shops, including needles, syringes, and fixed needles, needles from tip cutters, burners, etc., can be scalpels, etc., blades, etc., will be fall into the category of waste shops. And these waste shops has to be segregated into white, puncture-proof, leak-proof, tamper-proof containers. Container. It is not a bag. It is only a type of bag. You have to the container only. It should be a container. Should be white in color, transparent in nature, puncture-proof, leak-proof, tamper-proof. It should be translucent, means you should be able to see what is inside in the container, white container, and it should be puncture-proof, leak-proof, tamper-proof container. Only these type of waste shops can be treated by autoclaving or by dry heat sterilization, followed by shredding. This also shredding is a must. What for is shredding is must? Somebody can respond, please. What for shredding is done after treatment? Yeah, Amira?
Not for reuse. Not for
Not
use.
for reuse. In order to
Again.
avoid
To
reuse,
prevent reuse.
this shredding is suggested under the rules. And after mutilation or encapsulation, these waste can be disposed of by mutilation, by encapsulation, or by for the recycling, etc. can be used as permitted under the rules. And fourth category is all the glass waste, which includes broken or discarded and contaminated glass and metallic body implants. These are infectious. You see, infectious glass waste or discarded container and glass metallic body implants have to be segregated into blue container, puncture-proof and leak-proof boxes or containers with a blue colored marking should be there. And these can be treated and disposed of by disinfection. Means by soaking the washed glass waste after cleaning with the detergent and sodium hypochlorite solution, definitely for the purpose of treatment of the glass waste. After treatment, these waste can go for recycling. Therefore, according to the biomedical waste management and handling rules, there are 4 types of waste are there. Biomedical waste, one is yellow, second one is red, third one is
Blue, white.
and fourth one is blue. What is the
Yes.
first one? Yellow category. All human anatomical waste, anatomical waste,
Anatomical waste.
soiled waste, discarded medicines, expired medicines, chemical waste, chemical liquid waste, discarded linen, mattresses, beddings, all will fall into the purview of the yellow category waste. Microbiology, biotechnology, and other waste also fall into the purview of the yellow color category. And this second one is red. All contaminated plastics have to go under red category of container. And third category is waste shops. It has to be segregated into translucent, puncture-proof, leak-proof, tamper-proof white container. And fourth one is glass waste, infectious glass waste or body implants, metallic body implants. These all have to be segregated into blue color coded, the puncture-proof and leak-proof boxes or containers. These are the 4 categories of waste defined under biomedical waste as per biomedical waste rules notified by the Government of India. Impact of improper management of waste. What type of problems will be there? Suppose if this waste is not properly disposed of, anybody can guess, please, what type of problems will be there?
Infections.
Amiraji, will you please try? What are the impacts of improper management of healthcare waste? Can you please try? What are the problems?
So
What type of problems?
hospital acquired infections.
Any others can try? What type of problems it may pose? Yeah, Amiraji.
Yes, sir.
Problems. What type of problems may pose if healthcare waste is not properly disposed of?
Hospital acquired infections are affected. Before attending the hospital.
Okay, very good. Risha Sharma ji, will you please try? What type of problems may arise in case if waste is generated from hospital is not properly disposed?
Bloodstream infections,
Sir, our
catheter
own
associated
patients will be
infections,
getting affected again and again.
Fantastic. There will be infections within the hospital. It may cause infections. Yes. Very good. Fantastic. Any other problems? No problem. If you are wrong, also no problem. Please kindly say, react. Something you say. Yes. Yes, something. Suppose if there is a somebody told patient get infected. Yes, correct. If waste generated from hospital is not properly managed, waste that may cause impact for the patient who is undergoing treatment, who came for treatment. Instead, you will get infections. Therefore, you will die. Similarly, anything else? Similarly, yeah, you have to speak out. Guess patient who are there within the hospitals. There in the hospitals.
sir, hospital acute infections are only affected before I admit the hospital.
Okay. See, there are doctors are there, medical staff is there, scientific workers are there, general office staff is there, then visitors will be there. Within the hospital, you see, there are so many people, visitors who want to take care of, who want to come and see the patient. Then caretakers who are there as a part of the hospital to take care of the patient. Therefore, if healthcare waste is not properly managed, doctors may get infected, nurses may get infected, all the staff may get infected, visitors may get infected, caretakers may get infected. Apart from this, there will be sanitary workers who will be taking care of cleaning of all the hospital. Therefore, sanitary workers may be get infected, or waste handlers who are handling the waste within the hospital, they may get infected, or somebody is coming and taking the waste from hospital somewhere else, they also get infected. When waste is disposed of within the outside the hospitals improperly, then what will happen? If there is rain, what will happen? Rain will come and contact with the waste. That is going to cause the runoff contaminated with the biological waste. Then it is going to join in the water bodies, rivers, lakes. Then it is going to impact on the surface water bodies. If there is a runoff, then there is a seepage through the ground. Therefore, it is going to cause impact on the groundwater sources. You see the impact. Some waste improperly disposed of openly. Somebody has burnt it. Now tell me, any waste the burnt openly under uncontrolled conditions, then what will happen is it is going to cause impact on the environment by means of toxic emissions. When any waste is burnt openly in under uncontrolled conditions, then that is going to cause impact on the environment in the form of air pollution. Therefore, environment is going to be polluted with the toxic chemicals. Therefore, that is harmful for the health impacts for the humans. Therefore, if any waste is disposed of improperly, that is going to cause impact on the health of the environment, isn't it? Is it okay? Please understood?
Yes, sir.
Yeah, like no patients, medical doctors may get affected, nurses may get affected, healthcare the workers also may get affected, hospital maintenance personnel also may get affected, visitors also may get affected, healthcare supporting services may also get infected, workers transporting the waste also may get affected if waste is not properly segregated or treated, and workers in waste management phases also get affected. Scavengers, if any waste is there, poor fellow, for the sake of earning his money day-to-day life, then he is going to dabble with the waste, which he may not be knowing what type of waste is it. Is it infectious waste? He may not be knowing. He may dabble with this in the process. He may get infected also. Therefore, communities exposed to landfills, dump yards, improper disposal may cause impact on the environment. These are the impacts of improper management of hospital waste. Let us see what type of infectious waste, including shops, what type of problems may arise. Routes of exposure of infectious waste should always be assumed to contain pathogens. Yes, this waste shops means syringes, etc. Needles, syringes, etc. It contain infections. Therefore, when it is improperly managed, it is going to hurt it is going to hurt you also. Therefore, it is going to cause infections, because if you are not properly managed, then these shops are going to cause the infections through puncture, abrasion, or cut in the skin, through the mucous membrane by inhalation or ingestion. There is a possibility of different problems due to this. What type of exposure? Chain of infections. This you can understand properly. Means any infectious agent is there in the environment, is the host, because of the infection in nature, the environment is going to impact on the human, that causes different problems, diseases. It may cause disease, prognosis, disability, because of that depends upon this, the exposure, concentrations, and impact. Similarly, exposed to the toxic chemicals, etc. When toxic chemicals are exposed by the humans, then depending on the concentration, duration of exposure, concentration for the chemicals, etc., is going to cause impact on the human health, disease outcomes, then prognosis and disability may cause depending upon the exposure. Therefore, what type of problems will be there? Harmful effect of healthcare waste on human health. Infectious and waste shops that causes transmission of infectious diseases. It is going to cause transmission of infectious diseases. Okay. Harmful effect of healthcare waste on human health is, one is transmission of infectious diseases. Chemical and pharmaceutical waste may cause intoxication. Means they are absorbed through skin or mucous membranes or inhalation or ingestion. Therefore, chemicals may be taken by through when come in contact with the skin or mucous membranes when inhalation or ingestion. These are the problems that may be exposed because of the chemical and pharmaceutical waste. Physical injuries when contact with the chemicals, flammable, corrosive, or reactive in nature, then it may cause physical injuries. Contamination of heavy metals through food chain. For example, mercury. Mercury containing heavy metal. It is a heavy metal. If not properly disposed of, then it is going to reach to the food chain, therefore in the form of fish. Generally, mercury, if it is disposed of into the atmosphere improperly, then it is going to come into the water body. Definitely is going to come into the food chain through in the form of fish. Fish generally it contains the mercury content in their gills. When you eat it, therefore you are going to cause impact on the health of the humans. Genotoxic waste causes irritation to skin or eyes. Exposure may occur during preparation or treatment with a particular drug. And these are the common pathogens and routes of transmission. There are so many types of things are there which are available in the WHO document. Of course, this is not available in our the document relating to the IGNO course, but I have taken just to show you. Examples of hazards of nuclear waste, including shops, are acute potential hazards. It may cause potential hazards like hypodermic needles contaminated with patient blood. Any patient blood is contaminated with this shop. That may, if it is by mistake, if you are in coming contact with them, then it may cause impact on the when you expose to such sort of environment. Exposure to splashes of blood or body fluids, infectious. Any blood is there, if it is come in contact by the workers, which is highly infectious nature, that may pose threat to the impact on the workers. Concentrated pathogen cultures also cause impact on the healthcare workers if it is not handled properly. Shops pose a double risk: injury. First, it causes all these waste shops may cause problems like injury and disease transmission. Therefore, generally these are the shops will cause disease transmission if the shops are contaminated, and if it causes injury, definitely it is going to be infected your the workers who are going to come in contact with. There are so many problems are there. Similarly, the hazardous properties of the chemical waste are they are highly toxic in nature, corrosive, flammable, reactive, oxidizing, and explosive nature. They also may cause problem to the workers. Of course, these are all not required for you. This is what I want to say. Mercury waste management in healthcare facilities. Generally, mercury is a source of waste generation from hospitals, where the mercury you can expect in thermometers, and thermometers, for measurement of what type of the equipment is this? Thermometer is used for what purpose in the hospitals?
For checking temperature.
Measurement of temperature. Yes, fantastic. What about what type of equipment? BP, the sphygmomanometer. It is a BP, the operators. What type of equipment is this for measurement of
Mercury.
Blood pressure.
blood pressure? Therefore, if you want to measure the blood pressure, they use sphygmomanometer. It also contains mercury. Now,
Mercury.
you also mercury. Yeah, you also can expect dental amalgam. What is the dental amalgam? Anybody is having idea?
Sir, amalgam is a mixture of metals is called amalgam.
No, this mercury is used for the purpose of
For
filling of
using tooth decay
dental
problem.
decay. For
To
dental
fill
filling,
Fillings.
mercury use. Okay, that is also used as a dental amalgam. Then esophageal dilators. These are the esophageal dilators where the mercury is also used. The batteries and some sort of X-ray machines, potentials and medical batteries, they also contain some mercury. Therefore, these are the sources of mercury-based generation from the hospital, like mainly from thermometers, sphygmomanometers, and the dental amalgam. Generally, are the source of mercury-based generation from the hospitals. Now, what type of do you think when mercury is there as a part of the instrument? Can you call it as a waste? What is the definition of waste? Anybody can remember? Yeah, anybody can remember? What do you mean by waste definition? Any waste which is no more useful can be called as waste.
Unwanted or unused substance.
Yeah. Now you tell me, if mercury is there as a part of thermometer, can you call it as a waste? Thermometers can be called as a waste.
When the machine is not working, that is a waste because that is unusable.
No. Mercury, when it is a part of thermometers, can you call the thermometer as a waste?
No, sir, thermometer
Is
is
it
used
not
in
working?
temperature. That's why it's
Mercury,
not a waste.
mercury is when it is a part of a thermometer, it is an instrument, equipment used for the measurement of temperature. Therefore, it is not a waste, it is a product. Thermometer is a product, it is not a waste. Now let us go into next step. When you are using thermometer, there is a breakage of thermometer. It has fallen on the floor and breakage happened. Now, there are two types of waste. One is glass waste, other one is mercury waste. Now, can you call this as a waste or a thermometer after baking?
Yes,
Yes, sir.
sir.
After waste.
After breaking of thermometer, the waste generated is a waste. Means glass containing mercury, contaminated mercury, therefore it is a waste. It is a hazardous chemical, hazardous waste. And mercury, which is there spill of mercury on the floor can be called as hazardous chemical. It is because it is a highly toxic chemical. Therefore, thermometer, as long as it is used as a thermometer, cannot be called as a waste. If mercury is, as long as a part of thermometer cannot be called as a waste. But thermometer breakage, then it causes mercury, can be called as mercury bearing waste. Similarly, thermometer sphygmomanometer is also can be called as waste. No, as long as any waste is there as a part of any equipment, cannot be called as waste or hazardous waste. After breakage, can be called as waste. Therefore, hazards from pharmaceutical waste are there. It is going to cause risk that the active ingredients act on unintended targets, toxic risk if the contaminated food or drinking water, fire and corrosion risk because of solvents available in the pharmaceutical waste, risk of increasing microbial drug resistance through improper disposal in the environment. What do you mean by this? Suppose any pharmaceutical waste is there, if you discharge into drain, the bacteria which was there in the drains, they accustomed to this sort of environment and they get more immunity, they will not die. Therefore, resistance will be microbial drug resistance will be more fast where there is a discharge of pharmaceutical waste because they are accustomed to that environment, they are in a position to survive. Therefore, their immunity is more. Therefore, microbial drug resistance bacteria will be more if you discharge pharmaceutical waste unintentionally or without any treatment and disposal. There are so many hazards are there which you are not required to be not known. Some examples, just to understand some data on public health. WHO assessment of 22 developed countries in 2002 showed that 80% to 60% of healthcare facilities do not use proper waste disposal methods. Of course, this is a very old study. At that time, they found that the healthcare waste generated from hospitals is not properly managed and disposed of. From 18 to 60%, 64% of healthcare waste. Use of contaminated injection equipment. Earlier, when I was a child, I remember still all injections they used to put it in hot water and they used to needles used to be reused. Now this method is not there. Now this method is obsolete. All the needles are not reused. They're all disposable in nature. Therefore, only one time use of needles are there nowadays. All this reuse is not permitted. Outbreak of hepatitis B in India due to reuse of injection equipment claimed 94 lives in 2011. This is somewhere in Gujarat. There was a problem. Therefore, there was a problem in hepatitis B outbreak because of reuse of injection equipment. Once again, same noodles they started reusing. Therefore, that caused panic or epidemic in the form of outbreak of hepatitis B in India because of reuse of the needles or syringes. Some examples are there, like these are some what we want to say. I just don't want to elaborate on this. Suppose other public health and environment impacts. Improper incinerators may pose a hazard to people and the environment. What type of hazards may pose? Flue gases. If any waste is treated like this sort of incinerators, it is a single chamber incinerator. We call it a single chamber incinerator. This is not permitted. If single chamber the incinerators are used for the purpose of treatment of waste, biomedical waste, then it's going to cause impact on the environment, like in the form of flue gases, ash, improper burning of waste, synthesis of dioxin fuels. Means improper burning of waste causes dioxin fuels emissions, which are highly carcinogenic in nature. Therefore, improper incinerators may pose hazard to people and the environment. Healthcare facilities become sources of mercury released into the environment. Now, for example, any mercury thermometers breakage is there. If you are not segregating mercury waste, and if you are taking the mercury bearing that liquid and putting as a part of solid general healthcare waste or the infrastructure healthcare waste, then when you treat that waste in the form of incineration, that is going to cause impact on the environment in the form of emissions. Therefore, mercury is there as a part of the unsegregated waste. When you treat using incinerators, then the mercury is converted into the toxic gases into the environment. Therefore, when there is a rainfall, the mercury is going to come into contact with the water bodies and it joins the food chain. Naturally is going to cause impact on the human health and environment. Therefore, one has to be very careful. You cannot dispose of the waste. See, the improper hazards of healthcare waste are, one is, depends upon what type of the problem it may cause. It may cause infections of healthcare workers. It is going to cause impact on the healthcare workers, and it is also going to cause impact for the patients. Also going to cause impact on the rag pickers if the healthcare waste is not properly managed. It's also going to cause poor aesthetics, means looks ugly, dirty. Trade also come in contact with that sort of waste. Is also spread of disease may take place. Rodents also will come in contact with the waste. Therefore, there also causes spread of diseases. Suppose if waste are burnt improperly, not under controlled conditions, then it's going to cause impact on the environment. How? Going to cause air pollution. If there is air pollution, if there is a rain, all the toxic the chemicals which are there in the atmosphere that will come in contact with the water bodies, they're going to cause impact on the environment also in the form of the toxic chemicals in the water bodies. It is also going to cause, if waste are not properly managed in the healthcare sector, it is going to cause infections, injuries to the waste handlers. If it causes injuries, naturally it is going to be infected with the infectious the microorganisms. Therefore, that is going to cause health impacts on the workers also. Therefore, water pollution, it also causes water pollution. Therefore, if the healthcare waste is not properly disposed of, then it may cause impact on the water bodies when it comes in contact with the rainfall and other things. The 1 minute, please. It is going to cause impact on the it causes a disease like HIV, AIDS, it may spread. It's also going to cause impact on the supporting staff, medical staff, rag pickers, etc. Therefore, the waste generated from hospital has to be disposed of properly. The poor management of waste causes air pollution, the contamination of groundwater, surface water bodies, the open burning of waste also causes impact. Improper management of waste also causes impact in the environment. What type of problem it may cause? It may causes environmental problems like water pollution. It may also cause soil pollution. It may cause air pollution and public sensitivity, like unaesthetic and offensive, And health impacts like injuries due to physical, like shops. If shops are not properly managed, then it is going to cause physical injury to the workers or anybody who is handling the waste. Chemical, it may cause impact on the because of on the health because of the toxic nature of the chemicals, corrosion nature of the chemicals, flammables and reactive chemicals. Infections, it may cause occupational health hazards if healthcare waste is not properly managed, and in thereby it may cause impact on the healthcare professionals. Hospital acquired infection may cause for the healthcare workers also within the hospitals if it is not waste is not properly managed. Therefore, in the overall scenario, what I want to say is that impact of poor management of waste or may cause health impacts, it may cause unhygienic conditions, it may cause air pollution, it may cause soil pollution, water pollution, etc. And it is causes spread of diseases because of improper management of waste. If so, now what are the various measures that can be taken? One is principles of healthcare waste management are we have to see that waste generated is properly reused, recycled, and reduce. And these are the 4 R's one should follow. Segregation of waste, proper storage, transportation has to be done properly, then waste has to be properly treated and disposed. These are the principles of healthcare waste management. Any waste, if you want to manage not only biomedical waste, any waste, like solid waste, any other waste, it has to be segregated properly, depending on the characteristics of the waste. Then it has to be properly collected, stored properly, then it has to be transported properly, and properly treated and disposed, isn't it? Now, what is the waste management hierarchy is? One is the prevent. First of all, you try to reduce the waste generation by taking preventive measures, means by adopting social measures or by various methods, we can prevent generation of waste itself. Second hierarchy in waste management is reduce. Means try to reduce the waste generation by adopting the simple procedures. Reuse. All treated waste can be reused. Of course, not for the healthcare sector. Like any waste is there after treatment, the healthcare waste also can be reused for any other purpose. The waste generated by the generator may not be used by him, but that waste may be useful as a raw material for any other the manufacturer. Therefore, reuse of such waste can be allowed. Recycle has to be allowed for the purpose of manufacture of any other products, and recover. Any waste is there, you try to recover the waste recovery in the form of energy. Therefore, other waste, whatever the waste is there that you properly treat it, then go for energy recovery. Therefore, that is possible. You can use road making, that is reuse. I can go for recycling item, means I can go for manufacture any other products. Therefore, I can go for recycle. Then any waste which does not have any values, reduce, you cannot reduce, reuse, recycle or recover. All that waste has to be treated. After treatment, that waste has to be disposed of. Therefore, most preferred option in the waste management hierarchy is prevention of waste generation, and least preferable the waste management hierarchy is the disposal. Therefore, my goal for disposal should be very minimal, means I have to dispose of waste as minimum as possible, whereas I have to reduce the waste generation by adopting preventive measures. Therefore, most preferred option is the preventing of waste generation, and
Sir, can you open your video, please? We are not able to see your face.
Yeah, I have my video is open.
No, your voice is clear, but we are not able to see you. The picture is not there. I think video is not on.
Your video is
Sir,
on.
video is on.
Your video is
Is
on.
it?
Video on hai.
But I'm not able to see. I think.
Sir, we can see.
Okay. Thank you. Thank you.
Therefore, most preferred option is prevention of waste generation, and least preferred is as far as possible, disposal of waste should be minimum. That is the target. That means you have to adopt other measures like reduce, reuse, recycle, recover, and any waste which cannot be reduce or reuse or recycle or recover, then only that waste has to be treated, and ultimate goal for final disposal should be as minimum as possible, should be disposal. This is the waste management hierarchy. Of course, the why biomedical waste is important. In India, biomedical generation per bed per day is about 0.3 to 1 kg per bed per day. Whereas in developed countries, the waste generation Biomedical waste generation is about 2.5 to 5.2. It depends upon the status, type of treatment. Different reasons are there which they use for different purposes. Therefore, in developed countries, the waste generation is high, biomedical waste generation is high, whereas in India, the biomedical waste generation is ranging between 0.3 to 1 kg per bed per day. Of course, as you all know, from healthcare facilities, 80% of waste generated is 80% is non-infectious and non-hazardous. Remaining 15% of waste generated from hospitals is infectious and hazardous in nature, isn't it? Therefore, 20% is the infectious as well as the non-infectious but hazardous in nature, like chemicals and drugs. Whereas 80% of waste generated from healthcare facilities non-infectious or non-hazardous. Therefore, remaining 20% waste only you have to take care of so that we can minimize waste generation by adopting different social measures. Now, how to segregate the biomedical waste? Do you like to continue or do you like to have a break of 5 minutes? Do you like to have a break up to 5 minutes for 5 minutes, please? Then you can continue if you all agree.
Yes,
Yes.
sir.
Yeah, 5 minutes you can have a break. Okay, we'll join at 4:30. Now 4:25. We'll join at 4:30. Please. Can I have tea or something? Meanwhile.